A patient sits across from me. She's exhausted, not tired, exhausted. She's gained 15 pounds in the last year without changing anything. Her hair is thinning. Her skin is so dry it cracks in the winter. She's cold when everyone else in the room is comfortable. And she already went to her primary care doctor about this. She was told, your thyroid is fine. Your TSH is 0.5. That's within normal range. She left feeling like she was making it up. Here's the problem. That doctor wasn't wrong about the number, but normal range and right for you are not the same thing. And I'm going to show you exactly why. TSH stands for thyroid stimulating hormone. It's made by your pituitary gland in the brain, and it's the standard first screening test for thyroid function. The lab range most clinics use is roughly 0.4 to 4.5 milli-international units per liter. And here's where the problem is. A TSH of 0.5 all the way up to 4.0 may be considered normal, but they can represent very different metabolic realities in two different people. TSH is a signal from pituitary telling the thyroid to work harder. When TSH is low normal, the reasonable read is that the pituitary isn't having to push very hard. But it doesn't automatically tell you whether the thyroid hormone that actually reaches your tissues is where it needs to be for you. And that is the gap. A single number, treated as a pass-fail test without ever asking, how does this patient actually feel? And what does the rest of the panel of the thyroid show? In my practice, when I see a cluster of these symptoms together, thyroid function is one of the first things that I investigate, especially when there's no other explanation for this that can be found. Things like persistent fatigue that sleep doesn't fix, unexplained weight gain, or a body that fights weight loss, dry skin and brittle, thinning hair, low motivation or mental fog, cold intolerance, always reaching the person who's reaching for that sweater. In women, irregular menstrual cycles. Any one of these alone could come from a dozen causes, but when several show up together, and we've ruled out those other explanations, low thyroid function quickly moves to the top of the list, regardless of what a single TSH lab test number shows. So, what do we do differently? We don't throw out the TSA. It's still a useful starting point, but we don't stop there. The first thing I add is a free T4, the actual thyroid hormone circulating in your blood. TSH tells you what the pituitary is asking for. Free T4 tells you what the thyroid is actually delivering. When a patient has every symptom of low thyroid and their free T4 is sitting low in its range, even with a TSH that a lab would flag as normal, that's a patient that I'm going to treat because the numbers and the symptoms are telling the same story. Beyond that, there are additional markers that many functional and integrative doctors use to get a fuller picture of the thyroid and metabolic function. Free T3 is the active form of thyroid hormone, the one your cells are actually using. Thyroid antibodies help identify any autoimmune thyroid conditions, such as Hashimoto's thyroiditis, which is one of the most common underlying causes of low thyroid function. And reverse T3 is a marker some practitioners use to understand whether the body is converting thyroid hormone efficiently or is it shunning it into an inactive form, particularly when someone's under stress or has another illness. I'm not going to turn this video into a biochemistry lecture. The point isn't for you to memorize 5 lab values. The point is this: thyroid function is more than one number, and if your evaluation stopped at TSH, you may not have the full picture. Here's what I see clinically over and over. When a patient has the symptom picture and we bring TSH and the corresponding free T4 up to a level that's optimal for that individual, not just in range, they respond. Energy comes back, the brain fog lifts, weight that wouldn't budge starts moving again, hair and skin improve. That response is itself part of the diagnosis. It tells us we were looking at the right problem. This is exactly why thyroid function is one of the pillars of Factor 4, hormone optimization. Weight and metabolism don't run on willpower alone. They run on hormone signaling. If your thyroid signal is weak, everything downstream is working uphill. If you've been told your thyroid is fine, but you don't feel fine, dragging through your day, cold all the time, fighting your weight, watching your hair thin, you deserve a much fuller picture, not just one number on a page. And that's what we do in our clinic when we do a complete hormone panel, not a single checkbox. So it's important that if you've got these symptoms and no one else can explain it, have someone who understands this dig much deeper into your total thyroid function. And if they find it's a problem, they can treat it and get the proper treatment to optimize your thyroid function so your metabolism and your body is really just operating on all cylinders, just really moving along in the right direction. This is Dr. Greg Oliver. Thank you for joining my video. Please comment and subscribe to my channel, and I'll be coming to you again soon with the next video. So long for now.